Based on my previous experience in Thailand and my current practice in Australia as a registered midwife, here are the common situations. The hospital that I am currently working, I saw lots of women coming in because of this reason, and we always tell her to feel free to come in. Think about the complication that could happen as well. I would recommend to find a guideline. There are two guidelines that I would like to recommend. So the first one is the main idea of doing this Midwifery OSCE is to show the invigilator and the woman that you know what you are doing, you know how to manage in each situation, you are confident in your midwifery care that you provided to them, and you respect them as well. Try to sum up and make it nice and short and clear. Hello everyone, welcome back again to my channel. You are with me again, Julia. As many of you guys requested for, today we're gonna talk about OSCE. If you watch my video for the first time, welcome to my channel. I'm Julia, an overseas qualified midwife that migrated to Australia through the OBA pathway. I started create this channel to share with you about my experience regarding the process to get AHPRA registration, because I've been through lots of things and this is one of the way that I can share with you all. So if you are thinking about moving to Australia and need to go through this process, so stay tuned. We'll go through this together. I signed a confidentiality agreement when I did my OSCE, and it said I agree to not disclose or discuss with any person any information related to the examination. Therefore, this series of OSCE preparation videos will be based on my midwifery practice in South Australia as a registered midwife, and I cannot discuss any content or information regarding my experience in the OSCE exam. As you might already know, if you are a stream B candidate, you need to sit for 3 exams. So the first one is the MCQ exam. So the midwifery MCQ exam is the 180 exam questions, and once you pass the MCQ, you will be eligible to sit for the midwifery OSCE exam. And the last one is the English exam, and I always recommend to do the English last because it has a 2 years of expiry date. If you do the English first and you couldn't finish the whole process within 2 years, you need to resit for the English exam again. So do it last. Let's talk about OSCE today. So OSCE stands for Objective Structure Clinical Examination. So this is a practical exam that will test your knowledge and skill regarding the different areas, different scenarios of the midwifery care. And there are 10 stations for you to go through, and you need to pass at least 7 stations. Let's look at the midwifery OSCE handbook together. So if you have already read it, you might feel like it is very broad, and yes, it is. So it just says everything regarding the midwifery. So what is my recommendation for the midwifery OSCE preparation? When you prepare for the midwifery OSCE, make sure that you cover all areas regarding the midwifery care. So if you look at the handbook on page 9, it says OSCE station focus. You will see that they mention 4 main areas. So that included Antenatal Care, Intrapartum Care, Postnatal Care, and Neonatal Care. Then make a list of the possible stations that you can think of. Jot it down and make sure that you include those 4 main areas. Based on my previous experience in Thailand and my current practice in Australia as a registered midwife, here are the common situations. In each area, you will see the normal process and the complication scenarios. Antenatal. So as a midwife, you need to work in the clinic. So you will see the woman coming in for the first visit in the clinic, or it can be a subsequent visit. And if it's normal, you just go through the normal process of what you have to do when the woman come in to antenatal visit in each visit. So you need to check her Leopold maneuver, palpate her uterus, and check the baby and all that. That's the normal process. And apart from that, you also need to be aware of the complication that could happen as well. So what's the complication? So let's say you need to do some referral to the other healthcare professional like a mental health support, or you might need to refer her to some diabetes educator. You might need to refer her to the obstetrician if they need a medical review. And what else you can think about, if the woman is using drugs and alcohol, you might need to refer her to some support that can help her if she would like to stop using those. Okay. Also, during pregnancy, those women can come into the hospital in some like unplanned visit as well. Like if she is pregnant and she feel like baby move less than normal, like we call reduced fetal movement. So you need to be aware of that. What you have to do. In the hospital that I am currently working, I saw lots of women coming in because of this reason, and we always tell her to feel free to come in if she feel baby move less than normal. Okay, so you need to know how you're gonna manage that. And also, women might come in because of having bleeding, like antenatal hemorrhage, so you need to know how to manage that as well. She might need to be admitted to the hospital because of the uncontrolled blood sugar or uncontrolled blood pressure. Okay, so you need to be aware of that. Intrapartum. So as a midwife, of course, you need to know how to take care of the woman during labor and birth. You need to know the normal process of how to help her deliver the baby, and you also need to know about the complication that could happen as well. So what complication that you can think of during labor and birth? It can be shoulder dystocia because it happened before in my experience as well. It can be malpresentation, and that happened in my experience as well again. So you need to know how you're gonna manage that. It's gonna be like, let's say, a breech presentation coming in with fully dilated. It can be a frank breech. It can be like a footling breech as well. And what else that you can think of? Like obstruct labor, something that you don't want it to happen, but it can happen, you know. So think about that. Then postpartum care. So postpartum care, of course, you need to know how to take care or look after her during postnatal period. You need to know what's the normal process of the recovery after having baby. You need to know how to assess the lochia, how to assess the uterus, and if she needs the breastfeeding support, you need to know how to give her the advice and the support when she's still in the hospital. And think about the complication that could happen as well. So what complication that you can think of postnatal? So in my mind, first thing is the postpartum hemorrhage. Pretty common in every country, I believe, and it is the thing that midwife need to know how to manage that. And apart from that, it can be high blood pressure still, so women can still have preeclampsia even postnatal period. So you need to know what you're gonna do or how you're gonna manage in that situation. Apart from that, if the woman recovery well and you discharge her home, in Australia they have like a community midwife, like doing the community visit. So you need to be that person. You need to be able to be that person to visit the woman at home. So when you do the postnatal visit, you need to know what you are expecting to see and what is the uncommon thing that you should be concerned. Let's say you need to assess mom and baby. For mom, let's start with mom first. So you need to know what day is she postnatal. Is she recovering okay? Her breastfeeding going all right? Is there any crack or sore nipples? And check her uterus. How is her uterus doing? Is it firm and central? Check her lochia. What's the color now? Check that she passing urine well, open her bowel well. So that's about moms, and make sure that her mental health is okay too. Okay. And on the baby side, you need to check, of course, how many days after birth. You need to check baby weight every time that you do the visit to check that baby is growing okay. And check how is the feeding going. It can be breastfeed, it can be the bottle feed. Doesn't matter, it depends on what moms feel like. And also you need to check the baby's eyes, mouth, make sure there's no sign of infection. Is there any fungal infection, and what you will do after that. check the umbilical cord, make sure that the cord is nice and clean, and they might ask you how many days it can stay there for and how to take care of that. Okay, make sure that the baby passing urine well, pass the meconium, and is it transitional to the normal stool, like the yellow stool. So the advice is also important as well. Then newborn care. So newborn care, you need to know how to, once the baby has been delivered, you need to know how to check the AHPRA, of course, because you need to assess the baby, and every baby need to be assessed by AHPRA score. And you need to know how to do the head to toe examination, do a quick one, and make sure that everything is all right. You also need to know the complication or something unexpected as well, like pretty common that everyone need to know is a neonatal life support or newborn resuscitation. As a midwife, you must know that. And you also need to know once the baby transferred to the nursery or transferred to the ward with mom, and you also need to know if there is no sign of hypoglycemia, or if that happen, if let's say mom having the GDM, and then what you need to do with the baby, when will you check for the baby blood sugar, and what is the sign of hypoglycemia that could happen, and what will you manage that, or how will you manage that situation. Apart from that, on day 3 or day 4, once you discharge them home or you're about to discharge them home, you might see that baby can look a little bit jaundiced, and if that happen, what will you do? Will you check the SBR or the bilirubin level, and what will you do if the result is in the photo treatment zone or is below the treatment zone? What is your advice? You might need to check the feeding plan, and you might come up with a plan with mom, and also the follow-up as well. All right, once you check the baby weight, you might see that baby might have the weight loss. Another common situation that happen here in Australia as well. So we normally accept at 10% weight loss. If it's almost there, let's say 8 or 9% weight loss, you need to come up with a plan of what you want the feeding plan to be, and when will you follow that up again. Okay, so you need to know how to give mom the advice about the feeding, and when will you check or follow up that baby after that. Okay, what else you can think of? Let's brainstorm and comment down below so you can share that with other midwives who are on this process as well. Okay, and I will try to go through each situation in the next upcoming videos. So once you write down all of the possible scenarios that could happen in the OSCE, then I would recommend to find a guideline. There are 2 guidelines that I would like to recommend. So the first one is the one from SA Health, so it's called SA Health PPG guideline, and another one is from Western Australia, from King Edward Memorial Hospital. So I will leave a links for these 2 guidelines in the description box down below, so feel free to check out on that. What I recommend is to go through those guidelines, compare them together, and then come up with your steps. Okay, make a list of what you have to do in each scenario. Let's say 1 to 30 steps, starting from introduce yourself, check her identification, check her name, date of birth, and the hospital number, and blah blah blah, whatever. Different situations have different practice, isn't it? And then practice, and practice. Practice is really important. Do it until you feel confident in each situation. Do it until you can show them that I would say the main idea of doing this midwifery OSCE is to show the invigilator and the woman that you know what you are doing, you know how to manage in each situation, you are confident in your midwifery care that you provided to them, and you respect them as well. In Australia, patient-centered care or woman-centered care is really important. You need to show them that you respect them and they need to be a part of making decisions for themselves. Okay, and remember that you need to perform anything in each scenario within 10 minutes. So you only have 10 minutes to show them your performance. So try to sum up and make it nice and short and clear as much as possible. Okay, you have 10 minutes. If you practice and you take longer, try to cut it down and make sure that you finish it within 10 minutes, because they won't let you do it if the time is up. Okay, you need to stop and move to the next room. So make sure that you finish within 10 minutes. And if you need some support, there is a Facebook group that's created by Laila. It's called IQNM AHPRA Accreditation Support Group, Midwives and Nurses. So feel free to check out in that Facebook group as well. You might see someone else who are preparing and on the same page with you, so you can prepare for the OSCE together. Apart from that, there is the course, like a midwifery preparation course. Is an online one that's from Antigone. So she posts her details in the group as well, so go have a look in that Facebook group. Okay, another one that I just heard of is the prom course. I heard about that before when I preparing for mine, but I didn't do it because it's also pricey, like 1,000 or 2,000. And then yeah, I heard about that from Laila again. So this course is like a preparing course, not only for you who are doing the OSCE exam, but it's for any clinician like doctors, midwife, or anyone that would like to be trained to get familiar in each situation regarding the obstetric and this midwifery area. Okay, so go Google it because I'm not really sure about that. Yeah, if you know, you can share it down below so your friends or colleagues can come and have a look on that as well. Okay, those are my recommendation and resources regarding the OSCE preparation. If you have any other recommendation that would like to share, feel free to comment down below, and then other midwives who are preparing for this can come and check out on that as well. Alright, and in the next video, in the upcoming videos, I will try to get into each situation of what you have to do in each scenario. So if you are waiting for that, let me know in the comment of which station would you like me to start with, and I will go through that with you next time. Okay, otherwise, thank you so much for watching until the end. Don't forget to give me a thumbs up if you like it. Subscribe to my channel as well, that would be really appreciated, and I will see you in the next video. Bye for now.